If you have had an ectopic pregnancy in the past, you can give birth to as many children as you want in the future. Stop disturbing yourself. If you want to give birth to 100 children, 200 children, one tube is enough, provided it's healthy and other aspects of your fertility are fine. So don't let that deter you. Don't let that get you disturbed. Hi, my name is Dr. K, and I'm a doctor that talks about fertility, female reproductive health concerns, and safe pregnancy. And this is a safe place for you. This is where you get evidence based tips and information. So I want you to stick with me. Kindly subscribe, like, share, and comment. Now, what is an ectopic pregnancy? An ectopic pregnancy is simply when the baby forms and refuses to go to the womb of the lady to continue growing. Because when the egg from a lady and the sperm from a man joins to form a baby, it doesn't form in the womb. That joining doesn't happen in the womb. It happens in the lady's tubes. After it forms in the lady's tubes, it's supposed to now begin to move to the womb. It takes about 5 to 6 days to do that. For some reason, it can just decide to remain in the womb, or it goes to the ovary, or it even moves outside the womb and enters the lady's tummy on her intestine, or it goes to the neck of the womb. It's called the cervix. Or if the woman has had a cesarean section in the past, it can just go and attach to that cesarean section. And that has become an ectopic pregnancy. So the question is, what causes it? The thing is, if one has had an ectopic pregnancy before, it sort of increases the chances of having an ectopic pregnancy. It's about 1 in 4 chance. So 4 ladies who have had an ectopic pregnancy in the past, one of them will have an ectopic pregnancy again. Just sorts of reoccur in some ladies. The second reason is infections. If you have had infections in the past, untreated infections, the commonest are chlamydia and gonorrhea. They have a way of going to damage the tube of a lady, and then that tubal function is affected. The third reason is in women who have had surgeries in the past, whatever surgeries, pelvic surgeries, whatever surgeries, that can increase their chances of having an ectopic pregnancy. And fourthly, if a lady has endometriosis, because endometriosis can cause scarring in the tubes and other parts of a lady's pelvic region, and that scarring can affect the function of the tubes. Now, what are the things you want to be doing if you've had an ectopic pregnancy in the past? You want to do differently. Number one, immediately you get a positive pregnancy test, let your doctor know, because the approach for you is different from the approach from a lady who has not gotten pregnant before. Number two, if you have had an ectopic pregnancy in the past, right now you want to be screening yourself for some sexually transmitted infection, some infections. You and your partner, you want to screen yourself. This is really important. Number three, get a pelvic scan. Have a look into your womb. A scan can look into the womb properly. It's not very good at looking at the tubes, you understand, but it's like a baseline test. Conduct a pelvic scan. That can help you in having an idea of what's happening in your womb. And number four, now this is really important. If you've had an ectopic pregnancy, give yourself time to heal. Don't just get pregnant immediately. I know after 3 weeks you can get a negative pregnancy test and your periods can come back and all that, but give yourself time to heal, especially if you are the type that had surgery. You need time to heal, to recuperate, and then you can start again.